Today, we explore a groundbreaking study that uses MRI technology to reveal structural changes in knees before any signs of osteoarthritis appear on X-rays. This research, led by experts at Lund University and published in Osteoarthritis and Cartilage, followed adults over 6 years, tracking subtle but significant changes in their knee joints. The finding could reshape how we approach early detection and prevention of osteoarthritis, a condition that affects millions worldwide. Let's dive into how these changes were discovered and what they mean for the future of joint health. Researchers conducted a prospective cohort study, enrolling 340 adults with a mean age of 51 years, half of whom were women. None of the participants showed radiographic evidence of osteoarthritis at the start. In total, 680 knees were examined using MRI scans at multiple intervals over 6 years. The study divided knees into at-risk and not at-risk groups based on factors like previous injury, surgery, symptoms, BMI, knee bending, and family history. This careful selection allowed the team to observe how different risk profiles influenced knee health over time. MRI scans were performed at baseline, and then again at 24, 48, and 72 months. The researchers used the MRI osteoarthritis knee score system to evaluate key features: cartilage damage, osteophytes, bone marrow lesions, and meniscal damage. By focusing on the medial and lateral tibiofemoral compartments as well as the patellofemoral joint, the team could track even the smallest structural changes. This approach provided a detailed picture of how knees evolve before osteoarthritis becomes visible on X-rays. One of the most striking findings was that 76% of knees developed cartilage damage over the 6-year period, even though participants started with healthy X-rays. This damage was most frequently observed in the patellofemoral joint, which connects the kneecap to the thigh bone. The risk of cartilage damage in this area was significantly higher than in the lateral tibiofemoral joint, highlighting the importance of monitoring this specific compartment for early changes. In addition to cartilage issues, 18% of knees showed meniscal damage, and bone marrow lesions were also more common in the patellofemoral joint. The medial tibiofemoral compartment was particularly prone to meniscal damage, with a risk twice as high as the lateral side. These findings suggest that different parts of the knee are vulnerable to specific types of damage, and that MRI can detect these changes long before they become apparent on standard radiographs. Study found that knees classified as at-risk, due to factors like injury, surgery, or high BMI, were more likely to develop meniscal damage than those not at risk. However, there was no significant difference between the groups for other MRI-detected features. Interestingly, only 4% of all knees progressed to radiographic osteoarthritis over the 6 years, indicating that many structural changes occur well before traditional diagnostic signs appear. These results highlight the potential of MRI as a tool for early detection and risk stratification in osteoarthritis. By identifying structural changes before symptoms or X-ray evidence appear, clinicians may be able to intervene sooner, potentially delaying or preventing the onset of full-blown osteoarthritis. This approach could lead to more personalized monitoring and treatment strategies, tailored to each patient's unique risk profile. While the study offers valuable insights, it's important to consider its limitations. Participants were selected based on specific criteria and had to attend several follow-up visits, which may limit how widely the results can be applied. Additionally, the weak correlation between symptoms and structural changes means that some people may have significant knee changes without feeling pain or discomfort, complicating the interpretation of MRI findings. This research paves the way for future studies to refine early detection and intervention strategies for osteoarthritis. By leveraging MRI technology, scientists and clinicians can better understand the earliest changes in joint health, opening doors to new treatments and preventive measures. As we continue to unravel the complexities of osteoarthritis, early monitoring and targeted care could become the new standard, helping people maintain healthy, pain-free knees for longer.